You're watching Break the Pain on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. Accidents can happen so easily with children, and in the case of a Schuylkill County girl, she fell and landed the wrong way. Here's her story.
5, 6, 7, 8. Side cross back, side cross front, side cross back, side cross front. Go faster.
8-year-old Olivia Finnerty is like most kids, active. In her weekly jazz class, Olivia swings her arms and legs in all directions.
I like dance because it's fun and I like moving.
Olivia moved a lot in gymnastics too, until one lesson 16 months ago. Olivia remembers all too well what happened, and so does her brother and dad.
We were on the balance beam and we were just learning how to walk on the balance beam.
There are a number of balance beams in a row, and she was up on the balance beam, and they were supposed to dismount, jump off the balance beam. And she did. She jumped off the balance beam and kind of fell forward and stood up and said, "I broke my arm."
When I broke my arm, it did not feel good, and actually it was very bad.
Just unbelievable seeing that your little daughter with her elbow going the wrong way.
It was kind of tough because I love her so much, and it was kind of tough.
I took her to a local hospital. It was here in town. It was, 3 minutes away. And they instantly diagnosed that they could not handle that break, that break was beyond their ability.
The kind of news parents don't want to hear. Olivia's mom was 45 minutes away at work when the accident happened.
That's a hard call to get at work, so just thinking about the injury and what the possible complications can be, and then what the best solution would be to get her the help she needed.
And Sarah knew her daughter needed help. As an emergency room doctor, she's seen and treated injuries like this before.
It looked, from what they described to me and what I ended up seeing, very obviously broken or displaced.
An ambulance drove Olivia to Penn State Milton S. Hershey Medical Center, more than 50 miles away.
I was very relieved that she was going to be getting cared for by a pediatric orthopedic surgeon, which can be hard to find locally and even regionally.
Dr. Bill Henriquez was on call when Olivia arrived at the med center.
Olivia had fractured her arm. Both bones at her elbow were broken as severely as could possibly be. The bone that she has broken is called the humerus, and it's just above the elbow joint. That is the joint there. And these are the condyles, so it's called a supracondylar fracture. The fracture is completely displaced. The bones aren't even touching. This bone should be touching that bone.
Dr. Henriquez spent 45 minutes in the operating room repairing Olivia's elbow.
This is an x-ray in the operating room after we have realigned the two pieces of bone together and then held them secure with small, percutaneously placed just through the skin, fine wires that are the size of a paper clip. And these wires are left in the bone for about 4 weeks to allow the bone to heal in the proper anatomic alignment.
When Olivia walked out of there, we got to look at the x-rays, and it was, it looked beautifully aligned. So we had a lot of comfort with how it was going to heal.
And it did heal. Olivia wore a cast for a month.
I couldn't move it right away, it hurted a little bit, but not as bad.
I anticipated she would be immobilized longer, but she wasn't. She had an ACE wrap, kind of just to say, hey, be nice to me.
Olivia needed to be nice to her elbow for about 3 months. Then she could have fun, and she did.
It didn't take long before she was herself again and trusting it, signing up for dance class and being herself.
Good as new in every regard.
It feels very good overall. It's like it didn't even happen, really. It really healed it.
And we spent a number of hours with Olivia, and you would never know she had broken her elbow so severely. Chuck, you can see she's a real trooper.
And she is adorable. I love the line where she says, it's like it never really happened. Well, joining us now in the studio is Dr. William Enriquez. And, Doctor, you're the one that fixed up Olivia's elbow. And that injury, when you showed that x-ray, it just looked horrendous. How common is that kind of an injury?
Chuck, this injury is probably the third most common fracture in children. And it actually happens quite frequently with small falls like Olivia's fall. At Penn State Children's Hospital, we probably see about 2 or 3 of these significant injuries per week.
Per week? More boys, more girls does this happen to?
Surprisingly, I actually see it more often in girls because their ligaments are more stretchy and their elbows tend to hyperextend. So when they fall and their elbow hyperextends, they fracture at this specific location.
Now, in your story, you mentioned there's a risk of complications from this kind of injury. What would be some of those complications?
Well, thank goodness Olivia did not have any complications.
Good.
She healed up beautifully. But certainly, historically with this injury, you could injure the nerves of the elbow or the muscles of the elbow. And there is a small risk of a condition called a compartment syndrome that could lead to a disability for years and years.
Would this be in any ways maybe a forerunner of possible arthritis when she gets a little bit older?
Luckily, no, in most cases, Chuck. This fracture occurs above the elbow joint. There are some children's pediatric fractures that occur through the joint, and arthritis is definitely a possibility with those fractures.
What are some of the other, we saw how bad that one was, but what are some of the other common elbow injuries that you might be treating?
There's probably about 5 common elbow injuries. A nursemaid's elbow is very common, and that's a ligamentous subluxation. That usually does not require surgery. A lateral condyle fracture is a fracture through the elbow that does have a chance of arthritis that will require surgery. An olecranon fracture is another fracture through the elbow that may require surgery. And lastly, a medial epicondyle fracture, which is more common in high school athletes, oftentimes does require surgery as well.
Do you see more from sports than from just day-to-day life? Kids falling off bikes or anything?
In my practice, sports injuries are very common, and they're becoming more common because the children are so active now in year-round sports.
It is. Well, Dr. Enriquez, thank you very much for joining us here
tonight.
Thank you, Chuck. And
My pleasure.
We'll check in with Deborah in the call center. Deborah.
Chuck, it is very busy here. You can see the specialists are all on the phones right now. If you have a question, keep calling. Don't worry, the Med Center will get back in touch with you. Now, Dr. Gallo, we do have a question for you. Recently, I've had severe pain in my elbow. It feels like someone is stabbing me with a burning, sharp object. What could it be?
Well, there are several causes for elbow pain. Fortunately, the most common causes are tendinitis, such as tennis elbow. Oftentimes, these respond pretty well to non-operative measures such as physical therapy, injections, and even bracing. If these measures fail to improve your pain, you should see an orthopedic surgeon, and that may be another cause of your pain.
Okay, thanks so much. We'll check back with you in just a few minutes, and we'll go back to you in the studio, Chuck.
Thank you, Deborah. And after the break, Dr. Edward Fox will talk to us about osteoporosis, and we'll be right back.